And then the most important thing, and I think this gets to something that you and I both would agree on immensely, which is to understand and remember and connect with your why. And that for those of us who are driven by faith, remembering that and maintaining that as part of our daily practice. I think being connected to one another and being connected spiritually to our Creator is a very important thing in remembering why we would want to live, as long as many people say they would want to live. You say, why would you want to live to 108? Well, there's a reason why I want to live. And it's not just to live, but it's to live more fully.
All right. Well, I'm excited to be here today with Dr. James Breen. Good afternoon, Dr. Breen.
Good afternoon, Dr. Hartness. Good to be with you and your audience today.
So this is an exciting moment. This is a first featured healthcare connection video. So what we're doing is we're bringing to you quarterly healthcare professionals to learn about what they do and to learn how that they may be able to help you. And of course, to get some practical knowledge of how to be healthier. So Dr. Breen and I know each other from our faith community. We are both Catholic and quite involved in our local churches here. And we definitely enjoy each other's company, and we have a similar philosophy here at Allied Physical Therapy. We talk about body, mind, and spirit, and creating an environment that we can allow for discussions about God, about faith, about prayer. And so Dr. Breen has a unique journey that he's going to share now a little bit about Benedict Medicine and how he arrived at this spot. But Dr. Breen, tell us a little bit about your background, your story, and then, to where you are today.
Sure. So my name is Dr. James Breen. I'm a family physician, board certified family physician. I've been in practice for my 24th year in practice. Yes, I just recently opened my own independent practice here in Fort Myers called Benedict Medicine. And really the way I arrived at this model of practice, which we'll describe during the course of our discussion today, I've been in practice in different healthcare settings in the past. I've been started my practice life in a community health center out in rural New Mexico and also in Southeast Florida, and then found my way into academic practice. I was a core faculty physician with academic medical centers in Florida and North Carolina. And then really the model of practicing primary care, I think over the course of my 20 plus years in practice has really, unfortunately, I think it's devolved in a lot of ways that has really made it more difficult for patients and physicians to connect. And I think that that is really what led to me thinking that there must be a much better way to take care of patients that is both sustaining for patients and where I can give the best of myself to them and also know that I'm providing them with excellent care. Unfortunately, I think our largely kind of industrialized form of medical care does not really suffice for that purpose. And unfortunately, it treats patients as interchangeable and their clinicians as interchangeable. It basically puts everyone on a treadmill. And there are so many things about that were disturbing to me that I thought I'm going to try and create something from the ground up that really responds to patients' needs. So Benedict Medicine, which I just opened in January of this year, 2025, is that practice, is what I've been thinking and dreaming about for a number of years and really have decided to put to bring that to fruition. It operates essentially like a co-op. It operates on the basis of a monthly membership fee that patients pay. In return for that, they know that they have their personal physician, who is me, who takes care of them and responds to their medical needs. I can see them in the office when they need to be seen. I do phlebotomy here in the office. I draw lab specimens and send them to the lab. Contracted also lab rates with a local laboratory. Try to do things to make it advantageous for patients, both in the sense that their peace of mind is being met because they know they have their board certified family physician taking care of them. They know who's going to be there for them when they need it, but also to make it economically advantageous as well.
So, yeah, give us a little kind of, you know, what a visit looks like to your office and kind of how does it make it unique? How is it unique?
Sure. So, um, first of all, I would say what I've found, and actually this happens on a daily basis, when people call my practice, I answer the phone. And I've had many people ask me, like, is that Dr. Breen? Is this Dr. Breen on the phone? Because they're not sure what to do when the doctor is the one who answers the phone when they are calling to inquire about something. So it's very personal. It is very personal. Visits actually are also very unique because by the time that the patient comes to see me, if they come in the office, oftentimes we've already talked a lot about what their what we call the chief complaint, their primary reason for coming is. And so knowing that information means that they don't have to tell it to four different people and fill out 5 sheets of paper when they come into the office to see me. I already know a lot of the story when they come. Obviously, for new patients, that's not always the case. Although when patients do enroll, they do enter some information that they can do in the privacy of their own home through our secure portal, and I can get that information before they even come, and it can help to anticipate some of those needs as well. But the visits really vary because they're exclusively with their physician. Like I said, I even draw their blood. So we have a lot of time to talk about different things and get to know one another outside of just the very sterile type of typical clinical interaction.
So yeah, I mean, I think what I'm hearing is you build trust, high trust with the patient and, understanding them and, being able to make better recommendations based on the whole person.
That's exactly right. And I think that's the other piece to this that is so critical. One of the things that we say here at Benedict Medicine is that we are true to the Imago Dei, the idea that each person who comes through our door is made in the image and likeness of God, and that extends to every single one of those people who come to see us or call us or interact with us in any way. And I think that's such an important thing for us to bear in mind. All of us in healthcare really need to remember that. I think our healthcare enterprise in a larger sphere would do well to be reminded of that. So it's our job is in a little way to try and chip away at that and remind people of that.
So Dr. Breen, talk a little bit about you've been in practice 24 years, right? So yeah, what are some common things that you see that, as lay people, if we understand and know, it will really help us in our health and being healthy? What are some of those things that you could share with our audience a bit in
Sure.
terms of how to be healthy?
Yes. So actually, so aside from family medicine, my board certification in family medicine, I'm also a diplomate of the American College of Lifestyle Medicine, which is really exactly what you're talking about. I think one thing that people don't realize is just how ordered our bodies are, our whole beings are really. But we need order. We crave some form of order, and a lot of times when people do not feel well, there's something that is out of order. So maintaining good sleep practices, um, uh, maintaining a healthy diet that is heavy on, high fiber and low on processed foods, but then also remembering that regular activity, physical activity, and those sorts of things, eliminating smoking for people who do use tobacco, limiting alcohol consumption, and then the most important thing, and I think this gets to something that you and I both would agree on immensely, which is to understand and remember and connect with your why. And that for those of us who are driven by faith, remembering that and maintaining that as part of our daily practice. I think being connected to one another and being connected spiritually to our Creator is a very important thing in remembering why we would want to live as long as many people say they would want to live. You say, why would you want to live to 108? Well, there's a reason why I want to live. And it's not just to live, but it's to live more fully. And so that's what I think all of our medical enterprises should be about, is how we can help people with that. And then it's up to each individual to help respond to that question, interior question about their why.
Well, I think that's a message of hope. And I mean that because, you know, this isn't surgery or some invasive, you know, treatment solution. It's more of a behavior. These are relatively I'll use the word simple, but difficult things in terms of, you know, sleep, nutrition, you know, keeping our why clear. But yes, I mean, this is when I go to the primary care in the past, they never asked me anything about this. So,
And it's probably because they don't have a lot of time to ask you, honestly. And,
yeah.
and I think it's first, it's not really emphasized. It hasn't been emphasized historically in medical education. But secondly, it's not the way the model is currently structured. It's not structured to ask those questions and to probe into those elements of each patient's well-being, the way that we're talking about them today.
Mhm.
Yeah. Some of your audience may be familiar with like the blue zone studies and things
Yes.
about
Yeah.
longevity, which are so fascinating. And the thing that I find most fascinating is you ask these, little old people in Sardinia or in these places in the world where, where they're known for longevity. They're not rattling off dietary things to you. They're not rattling off, certain exercises that they did for 108 years. They're basically things that they have adopted in their way of living, and they're often things that are in their very closely knit communities. They're people with deep ties to the people around them, to their kinsfolk and the people in their communities, and those are the things that you can't bottle them and put them on a shelf, and you can't order them through Amazon. Those are the things that we really need to try and cultivate in our own lives. I think that's really the most vital thing to
So what
begin.
do you think? I mean, I'm thinking in a world today where it's, so digital and less communal. I mean, what are some practical things we can do to, you know, establish our why if we don't know what that is, or to get into community? Where do we find these important and, vital, you know, habits or behaviors?
That is, every journey of 1,000 miles starts with a single step. And I think the very first thing is just to look at the people in your own life who are closest to you and really, I think, making those connections, looking for simple things. In fact, one of the things that we talk about in lifestyle medicine as a discipline is the idea of small incremental change over time leads to much, very big benefits down the road. So it's not about sort of the January 1st, I need to clean out my cupboard and join the gym and do all these things. It's about every journey of 1,000 miles starts with that single step. And if you can find one thing that you can master in that journey and master it, succeed in integrating it into your way of living, you'll feel empowered to make the second change and so on. And one of the things I do as a lifestyle medicine practitioner is help people to come to their own to answer those questions for themselves, and then holding them accountable, reminding them and giving them tips to help them succeed in that journey.
Yeah, I think of the word trajectory, just kind of like you adjust the direction of your life. It's you could get into stormy waters and it could kind of put you back in a place where, the waters are rough, and you got to kind of get out of that, difficult stage. But yeah, I like the idea of habits, adjusting your trajectory, and having your healthcare provider speak in those terms, and I think most people, they want to explore these more deeper issues that a lot of times it's take a pill, go get this imaging test, go see this surgeon for a possible procedure. And so yes.
I think that people are, in my experience, people really they know that they need to have that kind of connection with people who provide them care. And I think that obviously from my years of work and also working with physicians in training, residents and medical students, people yearn for that kind of connection. Caregivers yearn for that kind of connection as well. And so we need to create spaces where that can really happen in an authentic way. That's what my practice is about. And I know that's what Allied is about as well, Allied Physical Therapy, about creating those spaces to make those connections, to help. And that's sort of the magic ingredient that isn't on the bottle, but that's what really helps, I think, people to heal.
So yeah, let's talk a little bit about some ways, we're so accustomed to this insurance model. It might seem like, co-op model, direct care,
Yeah.
you know, what are some of the hurdles maybe that you hear and address kind of, the benefits.
Yeah.
I'm thinking a little bit about high deductibles and you have a
Yeah.
plan and it's still so expensive to go to the doctor
Yeah.
and so yeah, what is yeah, just kind
Sure.
of some of the advantages in a world where it's so insurance driven.
Yes, that's a wonderful question, Matt. And I'll tell you, I think that that is one of the things that I find because this idea is something that is outside of sort of the mainstream or the norm, if you will. People have this idea that, I'm already paying into an insurance plan either directly or through wages that are garnished by my employer to pay for it. And I just can't imagine how I could pay any more for healthcare. And I understand very much that sentiment, which is why I've tried to create this in a way that's accessible to people. But what it is really is about, it's about knowing that you have confidence in the people who are taking care of you and that you know that they'll be there when you need them. Many people actually find my practice because they've tried to establish care in a conventional insurance-based practice, usually one of the larger, more industrial strength practices, if you will, and they're told that they can't be seen for 4 more months, and they have a need, and they need to be seen. And so they contact me, and I say, "Can I see you tomorrow?" And that to them is a real eye opener. Like, wow, you can actually see me tomorrow? Like, yeah, absolutely. It's an hour-long visit. I hope that's enough time. Because that's really what it's about. It's about making those connections, about being available when people need to be cared for. And then, as you were saying, or as we were discussing earlier, a lot of that care also goes on around the margin. So it's not just when people are here physically in my office space, but it happens beyond that as well, either through phone, through a video visit, much like our conversation is here today, through a simple message through our portal. It's amazing what things can be done when you know the person you're taking care of and when the patient knows their physician and knows that he'll be responsive to their need.
Yeah, that's
So,
definitely exciting and
yeah.
I what do you think I mean, I'm just thinking you would think, there would be more physicians and healthcare practitioners doing this. What
Yeah.
is it just the
Well,
industrial insurance model that's
so I'll tell you, it is the biggest challenge, I think, is explaining this model to patients so that they will understand its value and see it as something that they would want to invest in. I've also created it as a month-to-month model, meaning that I don't hold people to any, year-long contracts or anything. That being said, I think once people experience this level of care, they will be very loath to decide to cancel it and move back to the insurance-based model. I think that's really something in some respects, perhaps it's a bit of a crass analogy, but you're absolutely right. People pay huge amounts of money with deductibles that are getting higher and higher for very little in return for that. It's kind of like the airline industry. Perhaps you can fly to London for $350, but you can't take your underwear with you. You're kind of
that's
stripped down to
right.
nothing. So if you want to have a window seat, if you want to be able to use the restroom, pretty much you've got to pay the extra $95, and to take your bag, it's another $150. So I'm not trying to make this too akin to that. But what I'm saying is that what I'm providing is something that I think really serves people's needs. I feel that it is the best way to provide care. And if truth be told, if the industry of healthcare, which is not what I think it's unfortunate that we've come to discussing the medical profession as an industry, but if it really were looking to save money, it would facilitate this type of care because the amount that it costs for a patient to be cared for in their primary care needs in my office is far, far less than what is being allocated to primary care in a conventional insurance-based practice. So I think that's really, in my view, that's really proof that it's not just about the cost of the primary care. It's about all the other ancillary sources of revenue that come from those insurance-based practices, and which is where I believe it's important that patients know that I work directly for my patients and their best interests. And that is the only thing that is at the forefront of my mind in helping them to make medical decisions, which we make in tandem, in collaboration, and that's how it should be.
So what do you think, Dr. Breen, about, I'm just like insurance? Is there a does it have a legitimate role? Like, what would you say? Like, oh,
Yeah.
should just drop your insurance, sign up with
No.
you? Or do you say, well, in this context, insurance does serve an important need. What are your thoughts on that?
Absolutely. No, I think that's exactly right. I do not advise people to drop their insurance. And I also think it's my disclaimer at this point is I'm not either an insurance broker or an insurance salesperson, but I do think that insurance should really be for unforeseeable events that are beyond the ability of one to pay. So your auto insurance is, heaven forbid, that the car is in an accident or there's some other very expensive occurrence that you don't pay for your oil changes with your insurance. And I'd say similarly, primary care is the domain of medicine that most people should be able to pay as part of their personal maintenance, if you will. That's unfortunately not often the case because, again, those costs, those charges get higher and higher the more the system forces people to rely on insurance to cover them. So if you were to go into your average insurance-based practice and say, I'd like to just pay for my full annual physical in cash, you'll probably get a sticker price that's far beyond what you would have thought it would cost to provide that care. And that's why I think this is so important. I do not advise people to go without insurance. In fact, I do get, I do have, there are services that I will order for my patients that sometimes we'll use their insurance for those. Either if I'm referring them to a subspecialist because they need services of a subspecialist, or they might need, an MRI or something like that sort of imaging that requires insurance to pay for it. And even that being said, there are cash prices, which I have worked with providers of those services for, that are much, much less expensive than what you might think it would cost to get, a CT scan or an MRI. So even in those areas, I think it's important to do some price shopping before deciding how one will pay for them.
Yeah, that's very helpful because that is a question. Do I just drop my health insurance and come
Right.
to you? And
That's right.
yeah, I mean, I do think of, yeah, you need some emergency surgery or a
Right.
hospital stay. I mean,
Absolutely.
you're going to need some sort of
Correct.
insurance to cover that. So, but I like that analogy of like, the car insurance. I mean, you got to maintain your car. You got to change the brakes. You got to change the oil.
Yeah.
But if you get an accident and your car is unusable,
Yeah.
well, then that's when the insurance kicks in. So.
That's right. But you don't count on that, of course. But it's one of those things, and us living in Florida, we're very familiar with the need for, homeowners insurance. It's very important to have that because of where we live. Well, everybody, but particularly where we live. So yes, I think that's really the way that insurance is intended to be. And unfortunately, our health insurance has really become kind of like a prepaid, plan to try and negotiate costs down, and it really leads to all sorts of distortions in the way those things are priced, which then leaves actually the people who are least able to pay for them out in the lurch, because they're the people who typically are the people who are going in without any insurance are the ones who are given an exorbitant sticker price. They don't have the benefit of having, the quote unquote benefit of having a large insurance company that's negotiated down those prices with the providers of the services.
Yeah, that's really fascinating, and yeah, it's exciting, and I really congratulate you, Dr. Breen, for taking this step. It takes courage, it takes faith, it takes some
Yes.
sacrifice, and
Yes.
but I really think that taking this very intentional decision or step is gonna you're gonna want to practice this in its purest form and really yeah, make an impact to people. And so, yeah, talk to us a little bit about, and by the way, we will include information here, website, and some information and a way to contact you, but just verbally talk to us a little bit about, what is the step 1, 2, 3 to determine if this would be a good fit for me to become your patient.
Absolutely. So, as you alluded to, the first step would be well, you could certainly find out more details about our practice, the exact services that are offered, our location on our website, benedictmedicine.com. There's also a page there that you can complete that will send a form back to the office, and basically when people express interest in joining the practice, then I send them a link that goes directly helps them to create their own medical record within our system. And then once that's set up, then we can go ahead and schedule the first incoming patient visit and take it from there. It's really a fairly easy system once people have made the decision that they'd like to join. The other thing I would always say is that I'm always happy to talk with people who have specific questions, either by phone or through video, or even to have them if they wanted to schedule time to come by the office and we can talk. I would love to do that as well. Just I think making sure that people understand what it is that I'm offering and how I can provide them the expert care that they need as a primary care physician.
By the way, I just want to tell everybody I've been to Dr. Breen's office. It's beautiful, it's clean, it's fresh, it's got some nice windows in it, and it's a really inviting space. And so, as you said, healthcare starts in the margins, and part of that is a nice office. It's really set up in a way aesthetically that is a whole person approach, body, mind, and spirit, and definitely your office does that. So.
Thank you.
Well, thank you, Dr. Breen. This has been a lot of fun. I'm excited to collaborate together, and we do have about 4,000 people on our email list. So I really think this will be an answer to someone's need or someone's prayer as they watch this video and they're looking for someone like you, Dr. Breen. And we might have you on again sometime on maybe a deeper topic, whether it's functional medicine or whatever it is. But thank you for taking the time with us today.
Thank you so much for having me, Dr. Harkness. I appreciate that. And again, I look forward to hearing further conversations like this.
All right. Well, thank you very much. And with that, we'll sign out here.
All right.
Okay.